Hi, I'm Virginia from Right Clinic, and here with me today is Goldina. Thank you so much for joining us today.
Hi, Virginia. Thank you so much for having me.
Amazing. So, why don't we get started with telling me more about yourself? So, what do you do, and how did you get into it?
Fine. I am a pharmacist by training, and I've now pivoted from years of working as a clinical pharmacist, formulary manager, to an administrative director of clinical pharmacy services in a healthcare system, to now a medical communicator. I eventually founded KJC Media Health, which is really a medication communication firm that creates, medical communication for patients, for healthcare professionals. And interestingly enough, I've dabbled into strategic consulting, which came about from one of my clients that I've had. That has been my background of late.
Awesome. So, how did you get into it? What made you found your medical communication company?
Well, for I've worked as a pharmacist. My journey in pharmacy started by completing a pharmacy residency program, and I've really been fortunate enough to work in different capacities. As I mentioned, I've completed the residency program. I got to work in a VA medical center here in Washington D.C. And from there went to work in a military hospital, which is a shift from where I was before, and that was such a wonderful experience. From there, my family relocated to the Texas area. I got into a safety net hospital that really took care of patients who were most in need. Most of these patients can't go anywhere else in the medical center. So, a lot of social determinants of health issues, a lot of cost issues, and whatnot. But I can tell you, though, that throughout my career so far, from being a clinical pharmacist to leading a team of clinical pharmacy specialists working in different specialization, such as emergency room, infectious diseases. One of the things that I enjoyed the most was clinical research and drug information. I remember I did a clinical rotation at a NIH clinical center, and that was the worst. As a student looking back, it was the worst rotation because it was long hours. There was no room for error, right? Because it's drug information. Folks in the NIH were dependent on the clinical center to provide the right information, the right time, accurate information, concise information. So, but throughout my journey, it just keeps taking me back to drug information, being able to disseminate accurate, concise drug information. My organization that I was last went through a reduction in force, and it impacted my role. And I had the time to sort of reflect what to do next. And I started pursuing other roles, and I just wasn't excited. I got a really, really lucrative job offer, and I wasn't excited about it at all. And a colleague of mine that I reconnected with had suggested or reminded me, it's like, you used to love clinical research. You used to be the one that I call for any drug information. Why don't make this a thing? And I'll be honest, I didn't think about that. And I started networking. I appreciate and enjoy and love networking with folks, getting to learn what other people did. And I connected with another medical writer who was also a pharmacist, went through the same path as I did, but we connected years ago prior through LinkedIn. And I noticed that she was now doing medical writing, medical review work. And I reached out to her. And I can tell you that's really, after she went over, we had a conversation. That's when I decided to launch my business. I decided to start freelancing just to kind of get back into things. And it was so funny. One of my very first role was actually meant for a DO. In the job description, it was so clear that they wanted a physician or a DO. I decided to apply to it. I don't know what drove me to apply to it, but it was really about someone who had experience with therapeutic class reviews, someone who had experience in formulary management. I remember them seeing that, and that was actually one of the things because I did formulary management for so many years. So I applied, and I decided to reach out to the hiring manager on LinkedIn. and I said, "Hey, I know you're looking for a physician, but I think I can do this for you. This is what I've done for so many years." 2 days later, I got an interview. 2 days later, I got hired. And I was hired to do medical review for them. But as I did reviewed and looking through their website, I was making recommendations for, hey, this is outdated. You guys had a guideline on how to treat, flu, but I realized that the guideline was from 1987, so maybe we need to update this. And so they will now expect me, as I did review, they're like, oh, so the expectation was really, hey, Goldina, did you notice anything else? So that's how I kind of got into strategy, content strategy, is looking and seeing what makes sense for their audience, what made sense for their website to be able to continue on the mission and the vision that they had. So that has been kind of how I got into medical writing so far. And I can tell stories, but I'm so excited about this space right now. So, but yeah, that's really how I got into it. And from there, I've made some connections. I now work for other organizations like WebMD. Another connection on LinkedIn had referred me, which was fantastic. And it just kind of grew from there.
Amazing. So, what would be your top tips for someone who wants to try and get into medical writing now? What would be your like number one top tip?
I will say, just do it. Do your research, right? Like anything else, or even the regular work that we do, if it's non freelance work, do your research. Make sure that it's something that you have an interest in, um, and then make a decision, because medical communication or medical writing or editing space is such a massive space, right? Especially now, you can go the regulatory route, you can go the medication education route, you can go to CME route, right? To create and develop continuing education for pharmacists and physicians and other healthcare professionals. You can go the economics route, right? Being able to contribute to real world evidence as it pertains to medication use and increasing access for patients and payers, right? To be able to get that information in a digestible form to help them with decision making. So I would say, do your research, be open minded. And then as you pursue, I know that everybody always says you have to niche. But for me, I can speak for myself personally. Being able to leverage my pharmacy background to be able to do what I do, um, led to me not niching right away, right? Because I felt like I needed to get my feet wet with different aspects of medical writing. And as I mentioned, got into strategic content strategy, by mistake or by accident, which was fantastic. But I think being able to understand the span of what medical writing has to offer is really fantastic for most, and being able to narrow things down is going to be helpful. I still write for medical education companies. I actually have about three needs assessments that I'm doing right now for two different companies. Um, and it's really exciting to be in that space where you can do different things. Staying up to date is also going to be another tip that I will give. A lot of reading. So I had time to really um, research and read. And the world of AI right now is actually what I'm very obsessed about. So I'm doing courses that I can in AI. I've actually written some blog posts on AI, the impact, the role that medical writers have by staying up to date, right? Because right now there's a lot of, I don't want to say scare, but there's a lot of frustration out there, or misguided information about how AI will take over what we do. But I think as pharmacists and healthcare professionals and those in medical writing, I think staying on top of what tools are out there as it pertains to medical writing, how it can streamline operations, and how it can help you do what you do not right, because a lot of organizations still have that policy not to use AI to write, which I agree. I've tried it, and it's just the output sometimes not trustworthy. But that's the role, right? That's where as pharmacists, we can really leverage our skill set to read a sentence and know, like, no, that doesn't sound right. That doesn't sound like something we would talk to a patient about. That's not the tone that we would advise a patient on how to get a medication and how to take it appropriately. So that would be another tip. Networking is huge. For me, who went from clinical pharmacy background for many years to now transitioning out to this space, networking is going to be key. So I got a chance to join the American Medical Writers Association, and it's been wonderful as well. I attend the webinars. I haven't gone to a conference. I have it on my conference to go to in 2025. But leverage the webinars that they offer, the articles that they put out, really, really great stuff that they put out. Join a committee. I got the chance to join the my chapter's regional conference area. So I'm going to be part of planning our regional conference that is coming next month, next year in March of 2025. So I'm really excited about that. It allows you to meet other people. It allows you to grow and leverage expertise and skills from other people who's been doing it for years. Um,
Amazing.
yeah, yeah.
Cool. So, what's next on the horizon for you? You said you want to do more conferences, but is there anything you're developing in your company or as a medical writer? And you said you're like doing some courses now. What are you kind of looking forward to?
Well, I think one of the things that I've been doing is sort of building the personal brand as a medical writer, which was interesting. I was having a conversation with one of my daughters beginning of this year, and we were talking about our goals. She's in college, and she was like, I would like to post more on LinkedIn and share what I'm learning from my internships. And I keep telling her, you do it. And I realize I'm not even doing the same thing. So, so I'm going to take her advice, and I've been posting more just to, as I'm reading and I'm learning. I have an amazing editor that I work with, Joshua at Good RX, and he is amazing, and I've learned so much from him. So based on some of the things that I'm learning, I'm also reading and I'm posting more. I'm having people reach out to me actually asking, "Oh, can do you do coaching?" And that's something that I've been doing informally. So I'm actually working on an ebook specific to pharmacists and other healthcare professionals, sort of to a guide, to leverage the skills. You don't have to go do all these courses, and some people may want to do that, but using my skills as a pharmacist again and as a leader in a healthcare system, I think there's so many transferable skills we can leverage to do this. I think the part that we need to just sort of work on is just um, understanding the space, understanding the niche, what you have interest in, and go from there. And then I have other initiatives that I'm working. I'm going to be partnering with some other companies to do some work, and I'm really excited. So I can't wait to share that on social media and LinkedIn especially. And I'm going to continue to, do what I do with the American Medical Writers Association and continue to volunteer and continue to do what I do to grow my business as well.
Brilliant. Amazing. Well, thank you so
Yeah.
much for your time today. And thank you everyone for watching or listening. I hope you enjoyed this episode and you learned a lot from Goldina. I'll definitely leave some links in the description box below so you can follow her on LinkedIn and check out her company as well. Thank you so
Thank
much.
you. Thank you, Virginia. So nice to talk to you this morning.
A little bonus segment here. So, what do you enjoy most about being a medical writer?
I will say the flexibility that it offers. To be honest, I work when I work. Obviously, with my clients in mind. I have about 6 clients right now, so being able to manage different aspects of what their needs are is really, really clear, critical. So being able to work when you work, want to work like this weekend, right after we finish, I'm going to dive in and do some work. But then later on, tomorrow, I'm going to take some breaks. So it's just the flexibility is what I love the most about it. I can work while I travel. That's another thing. I love to travel. So being able to have an opportunity to work and travel and accomplish both goals at the same time is something that I absolutely love as well. But I think another thing I would like to share in addition to all of that is really leveraging the entrepreneurial mindset of running a business. Like if you're a freelancer, um, you are in business, right? You are in business for yourself. You are your CEO, you are your CFO, which is very important. You are your business manager because you got to structure your business appropriately for tax purposes. You are your chief marketing officer. You got to market and get your clients and do it in a nice way. And you got to network, right? Professional development is another big thing for me. So my goal is really to work 4 days a week. I haven't been able to accomplish that, but that's my goal for 2025 is work 4 days a week and use one day to really grow and train. As I mentioned earlier, AI is a big area of interest for me right now, and I'm taking courses and taking classes and implementing some of the things that I'm learning into my operations at this point. So that's another thing that I would like to offer as the flexibility to not just build the business, do the work, but also learn and do what you are passionate about. So,
Yeah, I love that. And I think also you get to do what your business kind of directs you to do.
yes,
So
yes.
wherever your business takes you, you will kind of follow. And you mentioned about getting into content strategy.
Yes, absolutely. And I think looking back, and I've been grateful for all the opportunities that I've had working in a health system, which is what I've done all this while I've worked in hospitals and health systems. But I think, as you say, it allows you to pivot very quickly, right? Because you are at times one person's business or one person's show. You are able to pivot to serve the need and grow in areas that you don't even anticipate. And that has been what I'm so excited about in this space. I've been invited to do more podcasts. I've been asked to serve in additional committees just because of some of the things I've shared about AI and whatnot. So, being able to do that, but also stay implement boundaries too, right? Because sometimes you can scope creep and shift away from what the mission is. So I think strategic planning, your business is also very, very important. And I tend to sort of have those conversations, even though I'm the one running the show right now. My husband is also sort of my part-time employee on the side with some of the things that I need. So having those discussions about strategic planning, it helps me ground what I'm doing, but also allows me to pivot to grow and do other things. So I'm really, really excited and happy for the opportunity to do this at this point.
Brilliant. Thank you so much for sharing that. And thank
Thank
you
you.
again.
Thank
Thank you.
you.
All
This
right. I
has
look
been
forward.
fun.
Yeah. I love it. I've really learned a lot from you. I've loved it. I've loved hearing your story and your enthusiasm and your excitement and how, you've just really built yourself up to actually get what you want at the end of the day. And I hope you do reach that 4 day a week kind of,
I know.
set up in future.
That's the goal, and I'll let you know. I'll let you know how it's going. 2025.
All right. Awesome. Thank you
Thank
so much.
you. Absolutely.